In tonight's Health Source Report, we got some good news for adults who just cannot focus. Many people think of Attention Deficit Hyperactivity Disorder as a problem just for kids, but many adults are suffering too. But a report in today's Journal of the American Medical Association provides hope for those of us trying to cope with ADHD.
2 years ago, June Richdale Russo was diagnosed with ADHD. Her son had struggled with the condition. She helped him cope by setting up a structured life. But once he graduated and left, June had problems focusing.
I realized that I was struggling with accomplishing just things on my list.
While there's been lots of attention on kids with ADHD, there's been less on adults. Riverside's Dr. Kristen Rundell says doctors don't know the scope of the problem.
Right now, we really don't know because there's probably a lot of people out there who've been undiagnosed or maybe misdiagnosed with something else.
She gives patients physicals to eliminate other causes before she diagnoses ADHD, and she says medicines do help. In the research in this week's JAMA report, doctors compared patients who just took drugs to those who also received behavior therapy. They learned to break complex tasks into simpler jobs and found people who also got that therapy coped better.
Medications don't do everything. They turn the volume down on symptoms, but they don't teach people skills to manage their symptoms.
June also copes by making lists and notes.
And then I could make my lists week by week, and then I actually make them also daily.
Dr. Rundell says we all have times when we get overwhelmed, but
if it starts to interfere with your job or your personal life, then we have to look at what's the underlying cause of this.
Now, there is a nonprofit group that helps adults with ADHD as well as parents of children with the condition. It's called CHAAD, C-H-A-A-D. Just go to our website, click on Health, and then Health links to learn more about that group. So what are some of the symptoms of ADHD? Well, here are some, just in case you might feel like you're suffering. First of all, problems like persistent lateness, poor organization, or procrastination. Mood issues can be a sign as well. Difficulty controlling your anger, your mood swings, or depression. And also difficulty concentrating when doing things like reading or working, and chronic boredness.
All right. Chris Bradley.